interval, and now you can see that the use has gone up again. It's gone down a little bit because we've got more new drugs, and a patented drug that's been actually a relative of misoprostol that's approved for this. But in GYN, it just keeps going up. And GYN includes things like abortion, IUDs, preparation before certain surgical procedures, etc. Okay. It should be right there. I think this thing may have lost its charge again, so let's just hit page now. So what are all the uses, and unless we charge this up again, what are all the uses that we can put to misoprostol? Well, these are all the things, these are all the organs it affects for us. It stimulates uterine contractions, so that's its use in postpartum hemorrhage and in induction of labor. It softens and dilates the cervix, which is its use also in induction of labor and also as a part of an abortion procedure. We know it treats ulcers. Unfortunately, it has these side effects. It causes nausea, vomiting, diarrhea, and in some cases fever. These are all what we call self-limited. They pass. They're transient, and they're directly related to the amount of time the drug stays in the system, which is only a few hours. Misoprostol leaves the system within a few hours after you give it. And there's some very interesting data, especially about fever, which maybe we'll have time for, which relates to a postpartum experience in several countries around the world, where in one of them, a significant number of the women got a high fever associated with misoprostol. And we suspect that's another concept called pharmacogenetics at work, where some people, due to their genetics, just respond differently to drugs than other people. One of the things and why this is, I have this underlined, is no bronchial spasm or no smooth muscle spasm with respect to the bronchial tree, is because a close relative of misoprostol that has been used in OB/GYN for a number of years causes severe bronchospasm. And one of the myths that we've had to overcome in using misoprostol is that it's not like its cousin. It doesn't cause bronchospasm and asthma in its users, so we can freely use it even in women who have a history of asthma. Oh, wait, go back one. And so why do I have fruits and vegetables up there? The reason is largely because in OB/GYN, we generally talk about things in terms of being the size of a fruit or a vegetable of one sort. So we generally size, we size the cervix. The cervix is mushy like a ripe avocado, or the uterus is about the size of a grapefruit or cantaloupe or a watermelon. So it's a very fruit and vegetable oriented specialty. Okay. Interestingly, this is again from the package insert, the US FDA package insert. It's category X, which means do not use in pregnancy. That's sort of duh, because it will produce uterine contractions, and yet obviously when you know what you're doing, you know exactly how to use it in pregnancy. There have been some occasions where it was used for abortion, and abortion didn't result right away. Later, there was either a stillbirth or a live birth where some congenital fetal anomalies were noted. It's really unclear whether that was due to the misoprostol or not. There's been no prospective or organized study, but we generally encourage women, if you're planning to use this for abortion, complete the abortion. At term, it doesn't have this effect, because at term, the fetus has everything it's going to have if it wants to go to Stanford or Harvard. And so it's not really a concern. But early in pregnancy it is, and that's why completing the process is very important. Next. Another pretty good thing about misoprostol is it's pretty well tolerated. You can take pretty high doses, very high doses, and you may get ill, but you probably won't die. There are some cases where there have been overdosage. These have been very rare, and in some cases, women have taken really large doses. So 6,000 micrograms is about 30 pills. And really that's enough for a small village or a village in terms of just getting effect. And this is what happens sometimes in environments where people don't know the drug is used in a clandestine way. There's lots of myths and rumors that have been circulated about how to use the drug. So one of our jobs, even in environments where we're using it for PAC, abortion is illegal, but we're using it for PAC, is to make sure that people know the right dosage, the right route, and the right interval between drugs if there's an interval. Next. And this was one case where there was death, but this woman, this participant, took 12 milligrams. We generally, that's 1,000 times, say, the dose that we would normally recommend. And so they did, this person did die, multi-organ system failure and intravascular coagulation. They couldn't clot their blood anymore. But this is an enormous, enormous dose. Next, please. Now, what I mentioned before was, and this gets to a lot of what we do now in sort of our programs, is we can give misoprostol through lots of different routes. Obviously, it's designed for oral use. That's what the company approved. If you want to take something for an ulcer, it probably makes sense to get it close to the stomach, which is how you get it there. But for our purposes, a lot of the organs that we want to get an effect on are not necessarily best approached orally. So if we want to get dose to the uterus, we can use the vaginal approach. We can use a rectal approach. But interestingly enough, we can also use these approaches that we call buccal, which is just putting the drug in your cheek pouch, like you're going to sort of suck on a cough drop or something, or a Tums. Or under your tongue. Sublingual means under the tongue, and we can put it there as well. And these two routes, I'll show you some graphs if that's what makes you happy. I can show you that basically when we give something that in the vaginal route, it looks very much like the buccal route and vice versa. And if I give something rectally or I give it sublingually, they look kind of similar. There are pretty good reasons for why that's the case, but that means that if I can give it buccally and I have a good effect, then why should I give it vaginally? Because culturally and sometimes in terms of personal comfort,